So here at Mission Hospital, we're a full-service emergency department, including the trauma center for all of South Orange County. And the way our trauma services work is we have a separate area within the emergency department where our sickest, most critically injured patients are treated, and that's our Mission Hospital Trauma Center. So we have the Children's Hospital here, so we're able to take care of all pediatric patients in the emergency department, from minor cuts and scrapes to the most seriously ill or injured children. We're a certified stroke center, we're a certified heart attack center, we're a certified trauma center, and we are also a paramedic receiving center and paramedic base hospital that services all of South Orange County.
To be able to recognize, those patients that need neuro services or need to be admitted to the cardiac floor or, are needing emergency surgeries. So by being able to have that diverse understanding of patient needs and then being able to pass that care onto the next level and being able to start that continuum of care for the majority of the patients that come to Mission Hospital.
A lot of what we do is prioritize. When something comes in the door, we figure out who's the sickest or who's the most injured, and we provide life-saving treatments first, and you have to reassess and keep going throughout your day.
We get a large amount of mental health and chemical dependency patients who come to us, and they're scared, the family's scared, and we're kind of there to make them feel like they're making the right decision.
We often receive a very large amount of homeless patients. Since they don't have a primary care physician, we are their only sole way of getting treated. If they have any infections, colds, even medical conditions, we are able to treat that here. And they can receive prescriptions, see a physician, get resources for other medical opportunities if they need anything like that.
For our pediatric population, we partner with CHOP Children's at Mission Hospital. What that means is that we are able to provide emergency treatment and care to all ages, and being able to really focus on the specialty of pediatrics and we don't just treat them like little adults. They are a unique population. So along with that goes with our whole family-centered model that, when you were caring for a child, there's also those parents and the family involved as well. So it's not just caring for the patient themselves, but for the whole family.
We are overseen by the Sisters of St. Joseph's, and they really truly care about our community and our patients. And it doesn't matter if they don't have 2 nickels to rub together or the richest person in Orange County. We treat everybody the same. There's no pressure on me to limit tests on somebody that doesn't have insurance or is poor. And so it makes my job as a doctor very easy to take care of everybody and provide the same high-level care to all the patients that come to our emergency department. One of the things that we really love about emergency medicine is that we can make a big difference in people's lives. From things as minor as an ankle sprain, where we provide pain relief and treat them and get them back on the road to recovery so they can get on with their life, to more serious illnesses and heart attacks and strokes. It's very rewarding to be able to provide these kind of treatments to patients so that they make a full recovery and get on with their lives.
It really feels like an ER family. We laugh together, we cry together. We see a lot of things here in the emergency room, and some are not happy. And so I think we support each other, we learn together, and we have a really great bond. And our team is, doctors and physician's assistants and nurse practitioners and registered nurses and patient care techs. And we work really closely with other departments, respiratory therapy, imaging. Our volunteers are amazing. So I really feel like we're really one big family, and it really feels like a family caring for your family.
The very best thing about the emergency department at Mission Hospital are the people who work here. We have a very strong faith-based mission that we follow, and I see the values that the Sisters of St. Joseph started, many years ago, continuing to be lived every day. This is a very challenging, sometimes very chaotic environment to work in, but the people who come to work here every day uphold those values of dignity, justice, excellence, and service. One of the best feelings is to be able to go home at the end of the day and know that you made a difference in someone's life. That's one of those things that not everyone gets an opportunity to do on a daily basis. And every day that you're here in this environment, you've touched someone in some way and been able to make a difference.